Welcome everybody to the COVID vaccination reassurer training. As I said, please be aware the session is being recorded. My name is Christina Gleeson. I'm a public health manager at Luton Borough Council, and I have a couple of my colleagues to join me today to go through this training with you. We're still waiting, I believe, on one of our colleagues. So if I make a start on the first bit, and then I'll hand over to my colleague Chanel. So next slide, please. So brief introduction. So as I said, my name is Christina Gleeson. We have Chanel and Abby to join us. So this training will, that's fine, you can move on, thank you. So this training will cover the role of the COVID vaccination reassurer. It will also go through the COVID-19 3A's tool, the current vaccination guidance, understanding how COVID-19 vaccines work, myth busting, facts, and locations of venues, and an escalation process. We're really keen to make sure that we outline exactly what our expectations are in this process for you. But just before I go any further, just a couple of housekeeping bits. Just standard social etiquette, Zoom etiquette, with people being on mute and raising your hand at the end when we have time for questions. And all slides will be circulated at the end, and we have a number of resources which we will also be circulating to you. So overall, the purpose of this training is to provide yourselves with a framework of good practice in health promotion principles through an established evidence-based model, which will be explained a bit more when we look at the three tools. So the three A tools come from very brief advice within the MEC framework. So the MEC framework is making every contact count. So we're really keen that we do make every contact count when we're talking to people about vaccinations, and we're here to reassure them and provide any evidence-based information that they need to overcome any complacency or hesitancy which they're currently experiencing. So if we move on to the next slide. So the role of the reassurers, we want you guys to be able to provide comfort and make an individual at ease about having their COVID vaccine. We want to provide the public with evidence-based information on COVID vaccinations, and we want to signpost individuals to further reliable sources and information on having their COVID vaccine. We don't expect you guys, the reassurers, to be experts in everything. Okay, so moving on then to the next slide. And here's where I'll hand over to my colleague Chanel to take you through the 3A's tool, Ask, Assist, Act.
Thank you, Christina. So this tool is used to help you have some short conversations with people and to encourage the uptake of COVID-19 vaccination. So some members of the public may be hesitant about receiving the vaccination. So this tool is to help you navigate those conversations for the people who may have questions or concerns. So it's based on 3 A's. They are ask, assist, and act. So the first A is ask. So step 1 is to be getting the conversation going. So try and be as friendly as you can, either be welcoming so they can approach you, or if you feel in the right and it's in the right situation, then you could approach them. Step 2 is to use questions or reflections to get the person to talk about what they feel. So you could ask questions like, have you had a chance to think about your COVID-19 vaccination? Have you been in touch, or has someone been in touch with you to have your COVID vaccination yet? Or do you have any concerns or worries about having it? So some tips we have here is to don't pressure them. Like I said before, trying to be as friendly as possible. Listen, and then say back to them what you've heard, just to make sure that you are fully understand what their concerns or questions may be. Don't take sides, so sum up the pros and cons as they see it. So some people, there's many different barriers to COVID vaccination uptake. So they vary among social groups, age groups, communities, ethnicities. So there may be some religious or cultural reasons influencing their decisions. So make sure you're understanding and discuss those implications with them. The second one is assist. So once you've understood the person's views and feelings, step one is to offer them appropriate information and advice. And then step two is to ensure it's personally tailored and appropriate. So you may ask them, may I share some information with you that may ease some of your concerns? Also, ultimately, however, the final decision is yours. You could ask them, would you like to hear about how scientists ensure the vaccines are safe? You could ask them, can I share some more resources with you? Or just sort of reassure them that you've also read some of these resources are from trusted sources like the NHS, and if they would like to, then you can share more of them. So the main tip on this section is to not be pushy. So rather than trying to push the vaccine, focus on providing evidence-based information and answers to questions for the people that may so able to make their informed decision. So for the last step is clarifying what their next steps are, and also to strengthening the person's intention or plan to get vaccinated, and then signpost them to further information or to their GP. So you could ask them, do they have any access needs in order to take up the vaccine? Because they might find that travel is an issue for them, or not knowing how to book their vaccine may be an issue for them. So the main tip for this section is to signpost them to where they can book and attend their vaccine appointment. Also signpost them to reliable information. So the 3A's approach is a simple structure of conversations to help them flow. It also ensures that we listen to people's concerns, reassuring them, and also at a minimum, keeping them open to the idea of getting the COVID-19 vaccination. So the goal isn't to persuade people to get it, is to reassure them and answer any questions or concerns that they do have around the COVID vaccination.
So I suppose before I go on to this bit, it's very important for me to say that I'm not clinically trained and Abby is a clinically trained colleague, which is why she was due to go through this bit. So I will do my best to talk through this bit for you guys. So the current vaccination guidance, who can have the vaccine? So we have our AstraZeneca vaccine, and that is for anybody who is aged over 40, or if they've had a AstraZeneca vaccination already, they should continue to have it unless advised to do otherwise by a health professional. And then the Pfizer vaccine is for anybody aged over 18 years. Who's not eligible, so that criteria has reduced greatly in recent months. So at the moment, it's anybody under 18 who is not clinically extremely vulnerable or a member of an identified at-risk group unless referred by their GP. So an identified at-risk group could be a member of the traveling community. It could be someone who sleeps rough or is homeless. Any person who is part of a community where their circumstances would put them at greater risk of contracting this virus, essentially. How long must you wait to have your second vaccine? So you must book the second vaccine for 8 to 12 weeks from your first COVID vaccine. Next slide, please. So understanding how COVID-19 vaccine works. So these are some common questions we hear quite often. So what is inside the vaccine? So reassuring people about vaccine ingredients, that they can vary dependent on the vaccine, but the main components are amino acids, lipids, salt, sugars, emulsifiers, etc. What they don't contain is eggs, gelatin, latex, or any preservatives, and they do not contain any metals such as iron, nickel, cobalt, lithium, or rare alloys. And those that question is often asked of: are the vaccines safe? Are they halal? Do they contain microchips, etc.? So that is a standard answer which could be given to answer that question. Is the vaccine specifically is the vaccine halal? Yes, none of the vaccines contain gelatin. The British Islamic Association has provided approval and assurance of this. How do vaccines work? Different types of vaccines work in different ways and offer their protection. With all types of vaccines, the body is left with a supply of memory or defense so they remember how to fight the vaccine in future. So again, the vaccine is there given to us to teach our bodies how to fight this virus should they become in contact in the future. And that is really important if someone talks to you about booster vaccines, etc., or if they've had the virus and they say they don't need to have the vaccine because they've had the virus. The vaccines give the best form of defense that we have against this virus, including new variants, because it trains our body to do so, and the instructions and the memory lasts that bit longer, especially with booster dose. It comes back into the body as a kind of a booster to remind the body of how to fight the virus. It typically takes 2 weeks to be after you're fully vaccinated for the body to build protection, which is called immunity against disease. That's pretty standard for any vaccines that are out there. So it's really important that people are aware that they're not fully protected the minute they get the vaccine. And also, even if they have the vaccine and even if they wait to 2 weeks, that they should still follow all the national guidance of hands, face, space, fresh air, social distancing, etc. Wearing face coverings when appropriate. So all of that would still stand even if you're vaccinated. What are the known side effects? So again, that's a really common one. So a really common question. So the areas of, sore arm where at the injection site, redness and swelling are really common. Mild cold-like or flu-like symptoms like tiredness, headache, muscle ache, chills, fever are also pretty common. So it's just to reassure them that they can take painkillers such as paracetamol if they need to. The area of blood clots or really rare side effects may often come up. So you can acknowledge that, yes, there are other known side effects such as blood clots, which are extremely rare. And again, we don't expect you to have any clinical based conversations. And if they specifically ask about the rarer side effects, it's important that you direct them to 111 or ask them to speak to their clinician. For someone who has a long-term condition, they might be under consultant care. So all of that to go to a trained clinician. Next slide, please. Myth busting. So the whole realm of myth busting is vast. So we have just picked out 3 of the common myths that are doing the rounds or circulating at the moment. One common one we've heard that the vaccine will kill you within 2 years. So really simple way of dispelling this myth is the vaccine causes an immune response. The body will clear out the vaccine quite quickly. And the vaccine won't still be in the body 2 years later. So therefore, the chances or risk associated of death associated with the vaccine, it just won't happen, essentially. If you've already had your COVID-19 vaccine and recovered, you don't need the vaccine. Touched on this already. So experts do not yet know how long we're protected for getting sick from getting sick again. Even if you've already recovered, it's possible that you can still contract the virus again. And studies have shown that vaccinations provide a strong boost in protection in people who have recovered from COVID-19. So it gives, as I said previously, that extra reassurance and strength to the immune system. Is it dangerous to have the vaccine while pregnant or breastfeeding? This may present in any form. You may get it as a fertility question or as a direct question on pregnancy and vaccination. Again, the idea is that you provide reassurance and direct the evidence. There is no evidence that the COVID-19 vaccine harms fertility or reduces chances of becoming pregnant. Although clinical trials participants have asked to avoid becoming pregnant, 57 pregnancies occurred for those people in the trials, and there's been no issues or significant differences so far within that group in comparison to the control group who got in the trial who got the placebo, the fake vaccine. So again, you can direct to the Royal College of Obstetricians, you can direct Public Health England, will give you a selection of resources where you can get all this evidence-based information. Abby, you have just arrived. I've just kind of taken over from you. Do you want to pick up from here?
Yeah, go for it. You're doing a good job. I was happy for you to continue. You're just about done. So locations of venues at the moment, we've got GPs and primary care networks helping us out managing units at Luton Central Mosque. So the faith leaders are very involved there. We've got Redgrave Children Young People's Centre is a permanent vaccination site, tends to operate between 8:30 and 7:30. They do walk-ins. There's a mixture of AstraZeneca and Pfizer there on certain days. Hightown Community Centre is operating for the second time this weekend on Saturday and Sunday, and they're going to be doing Pfizer there as well. So, just waiting for it. There we go. So there's always a clinical manager like myself on our site. So if you've got any concerns or you don't know the answer to things, just ask for one of us to come out and we'll help you have a conversation with whoever it is. You know, often people wanting quite clinical questions answered, or they've heard some things like they're allergic to walnuts and there's no walnuts in there. Although last year there was, at the start of it, there was a suggestion that if you had an allergy, you couldn't have the vaccine. That's not correct. So there's always someone on hand. All the sites have pod phones as well. And when we go and do outreach, we take phones with us as well. Next one. And yeah, just to say a huge thank you. We're really excited that you're all going to be joining us. Already having a lot of contact from people that want you to support with going around and speaking to our community, a mixture of places like shopping centres, the churches, schools, things like that. Often it's really important that they have someone to speak to who's not a clinician, because they worry that we've got preconceived ideas. We work for the NHS, and you know we're making you take your vaccine. We're not. So it's really good for them to have people like yourselves who can just answer standard questions and have a really good conversation with people.